I'm going to go over chapter 1 today of Dr. Bernard Jensen's Guide to Better Bowel Care. And I apologize for the glasses, but I can't see without them on, so you're going to have to deal with the reflection. This chapter was really great. One great takeaway that I had was an exercise called sniff breathing. And I'm going to just read from the book here because it does a really good job of explaining it. Robert Gaines, author of the book Vitalic Breathing, which is no longer in print, taught an exercise to the New York City Police Department to help increase their vitality for their lungs. Step 1. Walk 3 steps while sniffing only through the nose using short, rapid inhalations. Sniff deeper with each step. Second, on the 4th step, exhale rapidly and completely. For the next 3 steps, hold your breath. Step 4, exhale completely on the 8th step. Repeat steps 1 through 4. Now you may ask yourself, what does that have to do with bowel care? Well, all of your body systems are interconnected. And if you are the type of person like I am who gets stressed and starts to shallow breathe, that affects the oxygen that flows in your blood to the rest of your body. And your bowel obviously needs blood like the rest of your body does. It is one of the places where your body is going to restrict more blood flow than other areas like the heart, the liver, and those organs and systems which are going to need more blood. So sniff breathing will help you and your colon. The book goes on to talk about on operations and how in the 19th century they would operate on bowels and people would inevitably get better. We think that is a pretty intense surgery, and by all means it is, but we have doctors who nowadays will operate on people's stomachs, take their stomachs out in order to help them lose weight. So if that's not barbaric, I don't know what is. No less barbaric, I guess, than taking out part of your colon. But why remove organs when you can just help them function better? A toxic colon affects the body in myriad ways, one of which I'm going to read to you a direct quote. As toxins accumulate in the tissues, alterations in cellular function take place, especially in the tissues in which toxins have settled. Digestion may become poor. The partially digested material adds to the problem because the body cannot make tissue out of half-digested nutrients. When a person reaches the degenerative disease stage, it is a sign that toxic settlements have taken over specific parts or a part of the body. This is time to consider detoxification, the cleansing of the body tissues. The word detox is thrown around a lot, and what detoxification is the cleansing of the bodily tissues. If you start to show issues in other areas of your body, like your skin, your lungs, your liver, even your ankle, things like arthritis, those things can be symptomatic of a toxic bowel. If you want to help yourself in anything that is going wrong in your body, help clean your bowels. Get on a good program, consult your local colon hydrotherapist and anyone else who is going to help you achieve health. It goes on to give a brief lesson in physiology and anatomy with the small intestine. The small intestine is the site of approximately 90% of the absorption of nutrients into the bloodstream. I'd gone over this previously in a video, but you've got these little villi, finger-like projections that absorb nutrition, and if those get blocked because you have excrement backing up into your bowels, you are not going to absorb nutrition. Your body will think that it is starving. So people who have a trouble losing weight but are still eating healthy, they may have backed up bowels which are not assimilating the nutrients that they're taking in. The body thinks it's starving because there's no nutrition uptake and they cannot lose weight. So that's something to be mindful of as you walk towards health. There's a great picture or figure in here of a normal functioning large intestine that I'm going to put up on the screen. You may or may not know what your colon looks like. It goes up the right side and it's towards your back. So if you have back pain, that's usually indicative, at least on the sides, that you are having trouble with your colon. Any other questions there, you can always leave a comment in the box, but that gives you a visual of what your colon looks like. Most people think of their colon as their rectum, this area down here. That is not the case. You have 5 feet of colon. 5 feet, that's a lot of poop. Chapter 1 ends, talking about the large intestine and how there is a mucus lining that is smooth and does not have any villi. So you're not absorbing any nutrition in the large intestine or the colon, only in the small intestine. Um, the mucous membrane that is inside the rectum is striated to help move matter. So if you ever get stomach cramps or feelings of pangs, you may have something an issue with that part of the rectum. Lots of kids, when they're younger, they hold it when they have to go to the bathroom, and then when they get older, um, that stomach ache that we all disassociate with having to go to the bathroom, if you get a stomach ache, right, kind of down in your lower pelvic region, that is a sign that those muscles are trying to move waste, but they can't. So you may have an issue with your muscles there. That's one of the greatest reasons to try colon hydrotherapy, is because it helps to get that muscle functionality back. A lot of people come into me saying or thinking that, if they try colon hydrotherapy, their bowels are not going to function on their own, which is utterly ridiculous. That's like saying that if you go to the gym and work out, your muscles aren't going to work in the outside world because you've been training them at the gym. Colon hydrotherapy uses warm water to flush toxins out of the body. We use massage to gently increase blood flow, which carries oxygen to the muscle tissue, which your colon is a muscle, and it helps it to work and perform better, and will keep that muscle from either stretching out, or if it is stretched out, we want to pull the muscle back and get that blood flow moving again. So, if you've got any questions about the synopsis of this chapter, please leave them in the comment box. Thank you so much for joining us. We hope that this little audio book series is going to be very informative to you, and please feel free to leave us a comment or get a hold of us if you'd like to by private message. Have a wonderful day, and thanks for joining in.